For the cranial bones, right here we have the frontal bone, and then we have the occipital bone here. We have parietal bone. On the occipital bone, we have this little area right here. It's called the external occipital protuberance, and what it's used for is the securement of the ligamentum nuke. The other thing we have is the temporal area. The temporal mandibular joint. It's right in there. That's where it's at. It's a connector. We also have the mastoid process, which is right in here. And then what we also have is the styloid process of the bone, and that actually right in there. It's a little bone that comes out right in there. We also have the external acoustic meatus, and that's right in there. And we also have the squamous part, which is pretty much another name for the forehead. Okay. The petro is part of the temporal bone, which is on the inside, so it would about fall right in here, in this area right here. And the structures that are housed within this part of the temporal bone are the middle and internal ear cavities. So right in here. The internal acoustic meatus, it falls right around in here, in this area. And what passes through there is it transmits cranial nerves 7 and 8. Okay, so that's what gets transmitted through there. The external view for the sphenoid bone, it has, an internal and external view. It's the superior orbital fissure, and that actually, oh gosh, I drew a blank, I'm sorry. That actually falls right through the, how can I show you this? It's right in here. That's where the hole comes through for the superior orbital fissure, and what passes through is there. It allows cranial nerves that control eye movements, number 3, 4, and 6, to enter the orbit through there. Internally, looking at the sphenoid, we're going to look at the lesser wing and the greater wing. And those are a little bit harder to see on here, but the lesser wing I identified through the top right here, and then the greater wing is right here. The optic canal is this little black dot here. And then what passes through there is it allows optic nerves, cranial nerves to pass into the eyes. The sala turca is right here. And what structure that sits in this fossa is the hypophyseal fossa. Okay, next we're going to look at the ethmoid bone. So internally, we're still looking internally. The crista galli, which is this right here. What it does is the dura mater wraps around there, and the crista galli, what it does, it helps secure the brain in the cranial cavity. So that's what it does. The other thing that's here is the cribriform plate, which is this area right here. And what passes through the holes is the filaments of the olfactory nerves pass from the smell receptors in the nasal cavities to the brain. So that's where we get that part of it from. Okay, next we're going to talk about the type of sutures. So right at the top, we have the coronal suture, and the bone that is making that is a frontal bone. And then we have the sagittal suture, oops, which is right in here. And that is being made by the parietal bones. Next we have the lamb-bodied suture, which is this right here. And that's being made by the occipital bone. And finally we have the squamous suture right here, this right here. And that is being made by the temple. Okay, next we're going to focus on the facial bones. So we have the maxilla, which is right here, this bone here, the maxilla. And we also have, in conjunction with that, the alveolar process, which is here and here, kind of connects there. Next we have the nasal, which is here, the nasal bone. And then we also have the zygomatic bone. And that bone is right here. It's also known as cheekbones. The ethmoid bone is right in there. And then vomer is right in here. There's a little thing missing, but there's one in there. And what the vomer does is it's perpendicular, the ethmoid and of the maxillo bone. So that's what the vomer is. It's the nasal septum, and that's what it's made of. The perpendicular plate of the ethmoid and the maxilla bone. Next we have the inferior nasal concha, which is usually right in here. Okay. And what that does is it actually separates the nasal cavity into two bilateral and symmetrical anatomical cavities. Next, we're going to hop on over to the mandible. And we're going to go ahead and take a look at that. So this is the mandible right here. All of this is the mandible. In the mandible, this is considered the mandible body from here to here. Okay, and then the mandible angle is this little area right here. It's usually the mandible angle. The ramus is considered this area here of the mandible. The mandibular condyle is, I don't know if you'll be able to see it, but it's up here. Oops. That's the mandibular condyle right there. And then the mandibular notch is the top of it. Oh, good. So right in here. The coronoid process finally is this bone here. It came off, but that's where it's at. Okay, next we're going to look at the vertebral column. I'm going to point out some curvatures for you, which is this is 1, this is 2, this is 3, and then finally this is 4. 2 are primary and 2 are secondary. These are the primary ones, 1, and then here. I'm sorry, here. Okay, the cervical vertebrae is usually from C1 to C7. It has a total of 7. The atlas, it articulates right here. This is the atlas. Articulates to the occipital condyles of the skull. So it goes up to the top. Right beneath it, in order to do a head nodding. What is unique about the transverse process of all cervical vertebrae is that it contains the transverse foramen, unlike the thoracic and the lumbar. The thoracic vertebrae contains 12, and we're going to go ahead and point out some positions here. The spinosus is, zoom in here, it's this little pointy area here. The transverse process is right on the outside. If this rib wasn't here, we'd be able to see it much better, but that's where it's at. The internal vertebral foramen, this is a tough one to see on here, but pretty much it is, if I can get it into focus. Oh my goodness. It is these little openings in here. Okay. And the vertebral arteries and veins are the things that pass through there. The body or the centrum is this area here. This is the body. And then finally the position of the intravertebral disc. It is right here. That's usually where the disc's at. So it's a body and then the disc in between. The lumbar is your lower part of the spine, and that has 5. The sacrum is fused to this, so this is the sacrum right here, and that's fused to that. So we said this is the sacrum, and then finally right underneath here is the coccyx. Next we're going to the sternum. This is the manubrium right in here. This is the body of the sternum. This is the xiphoid process, and right at the top we have the jugular notch. Okay, and then we're going to talk about the ribs. There's 12 ribs. The vertebral sternal, which are known as the true ribs, it's 1, 2, 3, 4, 5, 6, and 7. So these up, from here up is true ribs. And then we have number 8, 9, 10, 11, and 12. And these are the false ribs. These are our floating ribs, this one and this one, since there's no attachment. These are called floating ribs. Finally, the head of the rib is here. It attaches to the vertebrae. And then the neck is right next to it, so it's just right there. And then the tubercle is, don't move it, is right here. This is the tubercle. So the rib attaches from, it articulates to the ribs from the wedge-shaped head, the